Saif there. I'm looking through our current participants, and I don't think Saif is with us. So, Saif, if you are there, can you just put something in the Q&A, and then I can find out what name you're under, and I can promote you to panelist. Otherwise, if there are any questions from the audience about this, then we do have some world-renowned experts up here on the panel in Paul and Charlie, so they can maybe answer your questions. Charlie.
So if I understood it right, for the revision dermofasciectomy, the patient satisfaction score did not improve. Is the URAM score was unchanged as a consequence of the surgery?
That's how I saw it as well.
So the question is, why were we doing the surgery?
And they looked equally powered. So sometimes you wonder about revision surgery, whether they're well enough powered, but it was roughly 50-50, the number of patients in each group, wasn't it? Paul?
Yeah, you can also argue that the URAM is not suitable for the population in Lancaster, because the URAM was designed in sunny France. And for instance, wearing gloves is something that somebody in Lancaster may find very important, is not in the URAM.
Yep.
So
there was a study by Vincent Hentz on redo dermofasciectomy decades ago that buried in it concluded that the patient's range of motion on average was not improved from a redo dermofasciectomy, and yet the vast majority of patients unequivocally thought it was a success. So part of it may be the art of medicine.
Just the counterfactual to what you said, Paul, was that in the primary group, they did see an improvement. So they were able to measure something. They were able to measure something. Yeah. We have a whole webinar on outcome measurements, I think, in 4 weeks from now. So we'll be able to discuss the nuances of patient-reported outcomes and how the science of that applies to Dupuytren's in great detail. Okay, I think we should move on to our final presentation now, and this is David Liu from Harvard, who is going to talk to us about routine pathological examination after limited fasciectomy.